My guest today is Elise Chesson, who's the Executive Director of Family Promise of Berks County. Elise, for those who might not be familiar with Family Promise, what does your organization do?
Sure. So we're part of a national organization that started many decades ago in New Jersey, one of over 200 affiliates throughout the country, that originally started with a program called the Hospitality Network. Its main focus is serving families and children experiencing homelessness. But since 2006, being in Berks County, we branched out to offer other programs, including our U-Turn program that serves homeless youth, and rent and utility assistance that kind of tackles that prevention, diversion, and rapid rehousing piece that many families and households face.
So obviously the pandemic has affected everyone. How has it affected your work?
Well, the Hospitality Network heavily relies on volunteers in the community to provide that overnight and meal portion of our services. So rotational models are not really happening right now with COVID. So we had to go down to a static model for a certain period of time. But as with all of the other emergency shelters, everybody's had to reduce their capacity, reduce bed counts, and address, social distancing and all of the precautions that we all need to take to reduce the spread of COVID. So it certainly reduced the capacity and everyone's ability to provide services to homeless families and youth.
So how does one practice social distancing in a homeless shelter or one of these organizations? That seems difficult.
Exactly. So part of it means that you need to reduce the number of beds that you have so that you can distance. For us, what it meant is reducing our capacity as far as how many families we could take in at a time. We're not an emergency shelter, so we do work with partners in the community who do provide that piece. So we're more of a transitional housing, if you will, for those who don't necessarily understand what it is that we do. But we were able to kind of reduce the amount of families that we serve and still be able to provide those services. But a lot of diversion, a lot of homeless prevention and rapid rehousing has been the focus. So instead of providing that shelter overnight piece, we're trying to focus on keeping people in their homes. Because it is difficult, as you said, to do social distancing when you're providing shelter.
So obviously there's been new issues as far as keeping people in their homes. And the governor recently extended a eviction and foreclosure moratorium in the state until the end of August. Has that been effective at keeping people in their homes?
It has, but there are still many instances of evictions continuing and being processed, or even households who aren't eligible because they just, meet that cutoff point where income-wise they're not eligible. And certainly the amount of dollars that we all have to provide are not sufficient enough to be able to even tackle the number of applications that we're seeing right now. So it certainly helps that moratorium was extended. It allows people to kind of navigate the system, see what kind of assistance they're eligible for, and it allows providers to be able to go through those applications. But it's just kind of kicking the can down the road. So the issue is still there.
You just said that you're seeing an uptick in requests for assistance. How many more people are reaching out to you?
So we're a small organization. On average, we were perhaps assisting households with $500 to maybe $800 a month to keep them in their homes. And the requests that we're seeing now are anywhere from $1,500 to over $3,000. And those are the ones that we're processing, and we're processing upwards of $15,000 per month of applications and requests for assistance.
So what does that end up looking like on the receiving side? Like, if you get this money, is that just specifically going to rent and keeping people in their homes, or what else are those expenditures going towards?
So most of the programs, like our rent and utility assistance, are funded through various streams. Some of them are the Emergency Solutions Grant, Homeless Assistance Program, or even private dollars. They all have stringent guidelines as far as how much assistance you can provide, who's eligible, and what the threshold is. Do they have a court-ordered eviction and whatnot? And so it could look like anything from 1 month of arrears to 3 months. But the goal of these programs and all of our partners who offer similar services is to keep people in their homes, because it's a lot cheaper to do that than have to deal with this huge influx of homeless families and youth that are kind of trying to get into shelter where there's no space.
So are you beginning to see an increase in the number of the homeless population at where you are?
In Berks County, it's always been an issue. In 2017, the Opaque Institute from Alvernia University did a study, and Berks County saw upwards of 4,000 plus evictions a year. And we were second to Philadelphia in the state. Most households were living on an average of under 25,000. Livable wage in Berks County was around $17 an hour, and the minimum wage certainly doesn't reach that. So even if you're working 2 jobs, you're not going to be able to make ends meet. Many of the households were paying above 30% of their income towards rent. So the issue of homelessness was already existent pre-COVID. Upwards of 2,300 kids who were homeless throughout this 18 school districts, or at least identified through the McKinney-Vento Act. And COVID has just exacerbated that already existent problem. Many people suffered job loss. Many people were still awaiting, answers from unemployment or seeking additional sources of income and not getting answers. So that kind of puts people behind 2-3 months of rent. And there are instances where they can't even catch up, even with some assistance. So in those cases, we're trying to provide rapid rehousing, but there is certainly a shortage of affordable quality housing as well. So even if there's the assistance there, there's always that, the need and demand for housing is there, but there's not enough to keep up. So homelessness is abundant. It's a continued issue, and COVID has just increased the problem.
You mentioned that perhaps more affordable housing would be a solution. What are some other things that would help this current situation?
Actually having landlords who actually want to give people a second chance, because oftentimes what we're seeing is we're working with these households to create a budget, stabilize their situation, help them achieve their goals and gain employment. But landlords don't want to rent. It's a risk. And my rebuttal to that is it's a risk to rent anyone, certainly in these trying economic times. So why not give people who are surrounded by supportive services and a community and budget counseling and case managers with resources at their fingertips, why not give these people a second chance and an opportunity? Certainly with some of the programs that we have, in addition to that support, we're able to at least guarantee whether it's a couple of months of rent or a security deposit and last month's rent. So one of those hurdles is getting landlords who want to work with us. And so I'm putting this invitation out there to owners, to property managers, to reach out to some of these service providers, not only to provide that housing to people in need, but certainly if some of their renters have fallen behind, some of them don't know about the programs that are out there. 211 is a great resource that connects all of these resources and us and agencies like ours. So that would be another hurdle and barrier, finding landlords who want to rent.
Well, that's all the time we have. Elise Chesson, Executive Director of Family Promise, Berks County. Thank you so much for joining me.
No problem. It was a pleasure. Thank you.
Hear stories from Pennsylvanians who served our country with Voices of Veterans on PCN. In a series of interviews, service members offer a rare glimpse into the stories that only they can tell. Watch episodes on demand with the PCN Select streaming service. To nominate someone for Voices of Veterans or to share your story with PCN, go to PCNTV.com. PCN, proud to bring Pennsylvania history and culture to you.
My guest today is Senator Joe Pittman, who represents Armstrong, Butler, Indiana, and Westmoreland counties. Senator, last week you and Senator Regan announced guidelines for a crisis fire company and EMS grant program. Can you tell us a little bit about that?
Well, this was legislation that initiated immediately after the pandemic hit, and we started to see the closures that were occurring statewide. When the federal government passed their stimulus efforts, one of the areas that I felt they had overlooked were the volunteer fire and EMS services. And out my way, our volunteer services use events, gun bashes, small games of chance raffles, things of that nature to raise revenue. And those efforts were shut down without any ability to prepare for alternatives. And so I felt that the existing volunteer fire program that we have, it's efficient, it's clear cut, and it's eligible to any fire company and EMS service that applies. I thought if we could use some of those dollars to replicate that effort and bring revenue to the table that would help them replace what they've lost during this time, that would be a worthy endeavor.
What was the financial state of these organizations like before the pandemic hit?
Well, volunteer fire services struggle with individuals volunteering, with keeping the doors open, the bills paid, and it requires them to do a lot of hard work to fundraise. The state and local governments do provide some level of support to varying degrees, but at the end of the day, it's still about them raising dollars locally. And so you find a lot of them, particularly in rural communities, to be in very precarious positions. And for them to give up fundraising efforts in such an abrupt way really put them in even further financial straits.
Now, who is eligible for this, and what kind of what are they receiving?
Any volunteer fire and EMS company in the Commonwealth is eligible, and it replicates the program that has been in existence since, I believe, 2002. And so it's a program they're all familiar with. It's very direct in that if you apply and you apply for one of the current eligible uses, you will receive the money. Equipment and debt service are two of the most common uses, at least in our area, for those dollars. So, for example, if a fire company has existing and outstanding debt on either a building or a piece of equipment, they can use this additional grant money to help pay those debt payments. They can use it for basic equipment, air packs, and things of that nature. So it really is able to be used for some of the most basic needs of volunteer fire and EMS services.
And you said that all these companies should be familiar with the program. Is
Yes.
it the same place to register for it as usual?
Yes, PEMA and the fire commissioner use this program every year, and they're basically replicating that for a second round. Is essentially how it's working.
Now, the pandemic has shined a light on a separate issue, which is the plight of rural areas of the state that don't have access to broadband. You have recently had a bill of yours moved out of committee that would allow electric cooperatives to utilize their poles for fiber optic cables. Can you explain a little bit about what that entails?
Sure. And with Senator Kristen Phillips-Hill and the leadership that she has had in the Communications and Technology Committee, we've worked to highlight barriers to providing broadband internet access that don't necessarily cost dollars and cents. And one of the areas that we have found to be a barrier is the ability for providers to access existing poles and attach broadband infrastructure on those poles. It can be time consuming and costly. So what we've looked at are, particularly for the rural electric co-ops, they have the existing infrastructure in place. Their easements are very old and outdated and don't technically refer to the term broadband. So what we're trying to simply do is indicate that those easements that are already in place as long as they do not physically alter or affect any of the property around the attachment poles, that they can use those easements to also include broadband infrastructure. This is a time and cost savings initiative that should help them advance projects more quickly and efficiently.
What are some of the benefits that rural communities can find from broadband access?
Well, I think the pandemic has highlighted the benefits and the need for access in rural communities. When our schools shut down, many of the students and families that we have were not able to access online learning as we would have expected. It's also critical for teleworking and telecommuting and things of those natures. So it's been a long known disadvantage in rural communities, but the pandemic has highlighted it greatly. And I'm encouraged that not only with my bill, but also with the dollars that have been made available through the federal government, that we're going to finally start to see some real advancement in addressing that issue.
As far as other issues regarding COVID in the legislature, the big one has been the Republicans' attempt to overturn the governor's emergency order, and there has been some new movement on that in the last week or two. Can you tell us a little bit about what's going on there?
Well, we have several concerns with how the governor has unilaterally managed this pandemic. And I recognize that the benefit of hindsight is perfect vision, and I recognize that we're all learning as we go. But the executive orders and the edicts that have been coming out, and they've been coming out almost a whiplash fashion, as we saw last week with the order of 25% capacity in restaurants and the limitation of indoor crowds, and having done that within a 24-hour period has been really debilitating. I've heard from families who have had weddings planned and large events planned for this coming weekend and the next weekend, and they have been completely disrupted with no notice. So we are advancing constitutional amendments to make sure that executive orders are limited in their length. I think it's very important to understand that we are a co-equal branch of government. And when you watch how the executive power has been used over the last 4 months, and given the most recent Supreme Court ruling, candidly, there's nothing that would stop a governor from issuing an executive order on their first day in office and running the state by edict for their entire term. And that's what we're seeing right now. And regardless of your party affiliation, we in the legislature are elected by our constituency to represent them. And they rightfully expect that we are going to have a voice in this process. And right now we have none.
So what is the kind of time limit that you're seeking to impose on an emergency order?
Well, the constitutional amendment, I believe, has a 21-day time frame on it. And as you know, constitutional amendments, they have to be passed in 2 successive legislative sessions. And what I think is most important is the voters ultimately get to make the decision as to whether or not the Constitution should be amended to reflect their will.
Now, on a more personal note, obviously the pandemic has affected everyone. Can you give a little insight to our viewers on how it's affected you personally?
Well, it's changed all of us in a significant way in how we work and do business. I have only been in the state Senate for about 13 months now as a senator, and much of our work is interaction with our constituents. We've become much more isolated as we're doing this on Zoom right now, and it's been very difficult to adapt in that manner. I, by nature, am a people person. I like to be around people. I like to engage my constituents. And we've been very limited in that regard. And that's certainly made things more difficult. Also, the anguish that we're seeing from our constituents in terms of their inability to get unemployment, their inability to understand what the executive orders mean in terms of their, can they work, can't they work? Could they buy a home? Could they not buy a home? Could they continue to build their home? I mean, it has been several months of uncertainty within our constituency. And again, what we discussed earlier, it's hard for us to provide answers whenever we're not part of the process. And right now, the governor continues to not have us be part of the process.
Well, that's all the time we have. Senator Pittman, thank you so much for joining me.
Thank you. It was a pleasure. Anytime.
Did you know you can watch all of your favorite PCN originals and more at home or on the go? Download the PCN app on your favorite device and tune in to see what makes Pennsylvania's heart beat. Watch videos on demand, see multiple live streams, and check out the free selected programs and events. PCN, Pennsylvania Politics and Policy, History and Culture, Sports, and more.
My guest today is Sara Simon, who's an investigative data reporter with Spotlight PA. This week, Spotlight published an article of yours detailing a claim about COVID-19 by UPMC. Could you articulate a little bit what that claim was?
Sure. So last week at a press conference, a UPMC physician he was discussing the rising case numbers in Allegheny County in the Pittsburgh area, and gave a few different explanations for why that might be the case. And it also explained that, it was okay because hospitalizations weren't totally on the rise, deaths weren't totally on the rise. And one of the reasons that might explain that justification, an increase in case numbers, but not yet a parallel increase in hospitalizations or deaths, was because the strain that they're detecting, this mutated strain of the virus, which we know to be true, is perhaps less severe than the strain that we saw a few months ago. That was a claim made at this press conference. A handful of news organizations took it kind of as fact and reported stories based off of it. But what we know is that the research doesn't really back that up. And so I spent, much of the weekend reaching out to UPMC, trying to ask them, where's this coming from? Can you please send me the scientific papers? I want to understand if this is the claim the physician is making, where's the science to back it up? So they sent me a link to a paper. I read the paper, and the paper states pretty unequivocally that there's not yet enough research to know whether this strain is more or less severe. So I sent that line from the paper to the UPMC communications office, and I said, okay, well, here's the evidence that you're presenting me with, but in fact it says something contrary to what your physician is saying. Like, what's going on? Is there something I'm missing here? Where's the evidence? So they sent me a link to a second paper. I read that academic paper, and again, same thing. It says there is no current research. There's further studies must be conducted to understand whether or not this strain is more or less severe. We just don't know that yet. So I sent that back to UPMC, the communications office, and I said, again, this is the paper that you're providing me with. This is what the research says, and I've not heard back from them since. So I then went to virologists, to epidemiologists, to talk with the experts who have been studying this virus, and they back up what the research says. Of course, they say there's just not the evidence there.
So why is UPMC making this claim?
That's a question that a lot of people are asking me. I don't know. I can't speak to why UPMC is making this claim. I could speculate, but that's not my job. My job is to just simply point out that the claim they're making is not backed up in science.
So within the academic literature, what is the data suggesting, even though it might not necessarily be definitive?
It's basically saying, here's what we know to be true in a lab, right? Here's how the cells are interacting with each other and multiplying in a lab. What we don't yet know is how that translates to people. There's just not been enough time yet. The research is not there yet. And again, what the papers say kind of definitively is that we don't have evidence to know whether or not this new strain is more or less severe.
At the end of your piece, you do mention that there is a suggestion that's been getting traction in media generally that the increase in infection rates, but the drop in death rates has been a result of younger people getting the virus. Is that true, and is that trend going to necessarily continue?
That's something I've heard from a lot of experts, and just kind of looking at the demographics, the populations of people who are currently testing positive for COVID-19, like it seems entirely plausible that with a younger population, it's going to have different effects, right? With, the relaxed social distancing, with bars open and now kind of closing again. But what we know to be true is that the population currently testing positive for COVID-19 is just kind of fundamentally different. In March and April and May, we saw a lot of cases in nursing homes and long-term care facilities. Majority of them, the people who were being infected, were older. Now, with a younger population, it's totally plausible to have different effects of the virus. One thing that I want to point out that a lot of the experts I spoke with said is we might not be seeing kind of the kinds of hospitalizations that we saw before, right? Like we don't have a lot of younger people on ventilators, but we don't yet know the long-term effects of this virus. We have no idea, people who are asymptomatic, people who are testing positive and maybe experiencing a minor cough, a mild, fever, and then recovering. We don't yet know what the long-term effects are going to be, whether there's long-term damage to lungs. We just don't know yet. We don't know about that with kids, which is a huge conversation as we talk about schools reopening. We just don't have that information yet. And so for a physician to claim, oh, don't worry, it's less severe than it was, it really raised a lot of red flags for a lot of people, which is why I wanted to dig in and understand where that claim was coming from.
On a similar note, as far as making sure people know what the problems with COVID are on a longer term basis, you published in June a piece about the data collection by the state of Pennsylvania. What is happening with our data collection, and what did you find in your investigation?
Sure. So my story looked at kind of from a bird's eye view perspective of the state's kind of overall data collection processes. And what my story found is that Pennsylvania, there's no intentional manipulation going on, right? I'll say that like right at the start. I have not found evidence of any intentional manipulation like we may be seeing in some other states. But what my story was about was that the state has taken steps. They've made decisions that make the public lose trust in the data. And so the story that I published in June was about kind of the failure on the state's part to safeguard trust in the data and what that means. What are the effects of that? And how can we really know moving forward as we kind of embark on this second surge here in the state? How do we really, what do we know? What do we don't? What can the data tell us? What can it not? There's still a lot of questions about that.
Does the state government deserve any slack on that, or are there things that are more egregious?
For sure, absolutely. I mean, this is public health funding in Pennsylvania is among the lowest in the country. This is difficult. We are all I'm working from home right now. You're working from home right now. A lot of the state employees are working from home right now. This is a global pandemic. It's complicated. It's difficult. The funding historically has just not been there. There's definitely slack to be cut. At the same time, what my story found is that, again, there are specific decisions made along the way about how to present the data, about maybe not disclosing methodologies, exactly where these numbers are coming from, about not totally being transparent about lags in data reporting. One of the things I'm looking into really closely right now is lags in death reporting. These numbers just take time. And back in May, the state health department was pretty upfront about that. There were a lot of confusing numbers happening, some surges, some spikes in the death numbers. That was due to data reconciliation problems. They did, I feel like, a pretty decent job of explaining that, like, okay, these deaths didn't all just occur in the past 24 hours. Some of them are weeks back. Those lags are still ongoing, but I feel like a lot of the messaging has kind of disappeared. So that's essentially what my story was about, was the decisions made along the way to kind of fail to provide upfront information about what the data means, what it doesn't, what are its limitations.
One thing that really stood out to me in the article was that the state doesn't have data for more than half of cases as far as race and ethnicity data is concerned. How is that possible, and why is it happening?
Why is it happening? It's not a priority, I'll say. That's my understanding. Why is that possible? And again, same thing. I mean, we just don't have this information. And one thing I want to touch on too, which I talked a little bit about in my article. I interviewed somebody who's kind of looking at this closely, is that even for the data that is there, we don't totally know what it means, right? We don't know how this process is collected. Is it self-reported? Is it not? Is it a physician's best guess? We don't know that, because the data that is made available, it's a lot of it's missing, a lot of it's there, but the data that is there, we just don't really understand how it's being collected and whether that's the same across the state. Maybe there's a pretty decent collection process happening in some of the bigger cities, but the more rural areas, we just don't know. We just don't have that context.
The state struggled to explain its data collection processes a month ago when you did the initial investigation. Have there been improvements since the article came out?
Not quite. I mean, I'm wrapped up in a conversation this week with the state health department again about these death numbers, about the delays. They have made it much more difficult for me to see the date that deaths are occurring. I give them credit that this is difficult, but now it almost seems like they're, again, making decisions to kind of obscure or make it more difficult for watchdogs. That's reporters, that's journalists, that's academics, that's researchers, that's kind of anybody who's interested in trying to keep an eye on these numbers. It's just kind of making it a little more difficult to get to the bottom of what's happening.
Well, that's all the time we have. Sara Simon, investigative data reporter with Spotlight PA. Thanks so much for joining me.
Thanks, Morgan.